Cognitive level and recent and distant memory capacities. A. Biopsychosocial assessment social section. B. Sexual orientation. C. Mental status exam intellectual functioning memory. D. Mental status exam judgment insight. A client of yours confides in you that her husband is misusing drugs and alcohol and might lose his job. What ought you to do? A. Tell your client to contact her husband's employer and explain the situation. B. Figure out if the couple needs additional casework services. C. Inform your client about services like Alcoholics Anonymous. D. Tell your client to bring her husband in next time and they can talk it over together. What is atypical development? A. Development that is right on track for their age. B. Development that has been delayed, but the same as their peers. C. Development that has been delayed or is different from their peers. D. Development that is different from their peers, but right on track for their age. Cognitive level and recent and distant memory capacities. A. Biopsychosocial assessment social section. B. Sexual orientation. C. Mental status exam intellectual functioning memory. D. Mental status exam judgment insight. A high school freshman, 15, thinks he is a police officer. Which of the following is demonstrated by this? A. A hallucination. B. Grandiosity. C. Metacognition. D. A delusion. What is the most effective method for getting a client to clarify their statement? A. Ask the client to rephrase the statement. B. Tell them they need to better explain things as it is difficult to understand what they are trying to say. C. Assume you know what they are saying and drop it. D. Rephrase the statement and ask the client if that is what they were trying to say. The most of the time, which of the following do not belong in client files? A. Demographic information. B. Emails. C. Psychotherapy notes. D. None of the above. Psychiatrist training is uncommon among social caseworkers. What ought they to do if they come across a person who is experiencing mental health issues? A. Be able to recognize these problems when they exist and refer the person to the proper source for treatment. B. Ignore the problem because you cannot help. C. Inform the patient that you cannot help and they need to go to someone else for help. D. Try to treat the problem to the best of your ability. Which of the following statements is regarded as a sickness sign? A. Fever. B. Numbness. C. Stomachache. D. Fatigue. Which of the 5 levels of Maslow's hierarchy of needs allows a person to discover their actual purpose, cope with the world as it is, and get a glimpse of what it means to be whole? A. Self-actualization. B. Physiological needs. C. Esteem needs. D. Safety needs. After 4 weeks of therapy, a social worker with a client isn't seeing any improvement. What might a social worker possibly do? A. Schedule a case consultation. B. Continue with treatment, it's too early for progress to occur. C. Confront the client about their lack of motivation. D. Refer the client to another social worker. You've been seeing a patient for a while who has been complaining about having a bad headache. What should we do next? A. Offer pain medication. B. Change the way you are treating the patient. C. Refer the client to a neurologist. D. Bring up the possibility of psychiatric testing. Which of the following describes a chronic alcoholic the most frequently? A. Blackouts. B. Slowness. C. Egocentricity. D. Psychosis. Which of the following depression symptoms is least likely to occur? A. Hopelessness. B. Trouble thinking. C. Sadness. D. Insomnia. What is cognitive development? A. Growth in hormones. B. Growth in thinking skills. C. Growth in height. D. Growth in sexuality. When a social worker is evaluating a client who has mental difficulties, how can they distinguish between delusions and hallucinations? A. Delusions and hallucinations share the same concepts. B. Delusions are fixed beliefs, while hallucinations consist of loose beliefs or half-truths. C. Delusions are false, fixed beliefs despite evidence to the contrary, while hallucinations are hearing, seeing, smelling, or feeling something that is not real. The group discusses its successes and feelings around the group's dissolution. A. Group polarization. B. Social justice. C. Static risk factors. D. End stage of group. A social worker is most successful when assisting a supervisee to use empathic communication while working with clients by A. Explaining to the supervisee why clients need social work services. B. Engaging in role-playing with the supervisee to provide feedback on verbal and nonverbal communication skills used. C. Helping the supervisee understand how service delivery is perceived from clients' perspectives. Mandatory reporting is true in every way, except for A. Social workers have a responsibility to both the client and the larger society. B. Social workers can report abuse even if it violates client confidentiality. C. Though social workers are required to report abuse, there are no legal consequences for neglecting to do so. D. None of the above. When someone is told repeatedly that everything will be okay, you can anticipate the following response. A. Have a great confidence in your ability to help. B. Doubt the person's ability to help and understand their problem. C. Be cautiously optimistic. D. Be indifferent. Which of the following best describes the difference between alcohol abuse and dependence? A. Physical need for alcohol. B. Responsibilities at home, school, and work are being neglected. C. Drinking habits hidden from others. D. Friends and family are concerned. The social worker is evaluating the client's history of drug misuse. Which model offers the most thorough justification for how complex substance abuse diseases are? A. Biopsychosocial model. B. Social model. C. Medical model. D. Family and environmental model. During the first encounter, a client starts crying. The best thing you can do is A. Sit with him quietly until he is ready to speak. B. Ask him to stop crying. C. Reassure him that he will feel better. D. Ask open-ended questions to find out why he is crying. A 28-year-old woman was sexually assaulted. She is crying and having trouble breathing when she phones you. The most crucial action to do first is A. Have her call the police. B. Call the police yourself, but get her permission to do so. C. Get her medical treatment. D. Give her phone numbers of shelters. Being a good listener is crucial for caseworkers. Which of the following better promotes listening intently? A. Offer verbal and nonverbal cues to show you are listening. B. Use a ton of nonverbal cues. C. Have your attention, empathy, and concern be communicated through your presence. D. Make comments every so often to show engagement. Which of the stereotype-related claims below is false? A. Stereotypes limit the acknowledgement of intragroup diversity. B. Stereotypes are often more helpful than harmful. C. Stereotypes of others contribute to group cohesion. D. Stereotypes can lead to discrimination of a group of people. An old client of yours is being discharged. She will be residing at home and will require a great deal of help. Which of the following ought she to keep at home? A. A maid. B. A friend. C. A home attendant. D. A companion. It is known as the tendency for informal group rules and practices to emerge and regulate how the group functions. A. Groupthink. B. Group coalitions. C. Group dynamics. D. None of the above. What is another phrase for steady state in the systems theory? A. Open system. B. Input. C. Differentiation. D. Homeostasis. The most common responses a social worker who passes judgment on clients will get are A. Resistance. B. Appreciation. C. Acquiescence. D. Cooperation. What is the best course of action if you are meeting with a client for the first time and they seem hesitant? A. Have the client agree with you so no conflict happens. B. Give the client your personal background and accomplishments to establish some trust. C. Set firm rules for the client to help them feel more comfortable. D. Allowing the client to share their thoughts and feelings while emphasizing that relationships are built with time and effort. Which of the following has a stronger correlation between children's academic success and emotional outcomes? A. Domestic violence. B. A natural disaster. C. A parent with a mental illness. D. Family income. You have a customer who shares many of your other clients' issues. What would be the best course of action from the list below? A. Help soothe the client's nerves by telling them you see this all the time. B. Try to see if this client has any big differences versus other clients. C. Consult with a coworker to get their thoughts. A woman's live-in lover has repeatedly assaulted her physically. He has been purchasing her pricey clothing for the past 3 days. This time frame is known as A. The intervention period. B. The tension reduction period. C. The honeymoon period. D. The safety zone. This phrase describes the belief that one belongs to a specific cultural, national, or racial group that shares or has commonalities with other groups, such as a common language, history, society, culture, or religion. A. Race. B. Ethnicity. C. Cultural diversity. D. Cultural identity. Her doctor informs a patient that she has breast cancer. She expresses her distress and lack of direction. She has 6 kids. Which one would you choose? A. Refer her for further medical tests. B. Encourage her to make provisions for her children. C. Provide supportive therapy. D. Refer her to a support group. Which of the following, taken alone, is not a significant predictor of adult aggression against others? A. Peers who are engaged in violent activity. B. Violent crime toward others in childhood. C. Gang involvement. D. Drug and alcohol abuse. What distinguishes private social agencies from public welfare programs? A. For public welfare, only financial assistance can be offered. B. For public welfare, all case records are open to the public. C. For public welfare, the needs of the client cannot be met due to costs. D. Public welfare requires all policies and procedures be based upon statutory authorizations. People's capacity to handle challenging circumstances and overcome challenges is referred to as A. Anger. B. Conflict. C. Frustration tolerance. D. All of the above. Your 17-year-old client is exhibiting behavioral issues as well as a lot of anger. You think about recommending him to a group therapist. Your primary focus should be on A. The experience of the group leader. B. Whether the group is heterogeneous or homogeneous. C. The structure and format of the group. D. The education of the group leader. During this stage of development, a kid can comprehend past, present, and future themes and can go from concrete to abstract thought. During this time, children also have a tendency to be egocentric. A. Concrete operational stage. B. Pre-operational stage. C. Formal operations stage. D. Sensoromotor stage.